Good evening to all. I am Kamachi from Aravind Eye Care System. Today I am going to present about surgical instruments cleaning and sterilization. We are surgical instruments cleaned to avoid toxic anterior segment syndrome and infection. Ophthalmic instruments have an important role in the delivery of the eye care. Instruments are delicate and require special care. To avoid infection, hand washing is very important because hands are the most frequent route of transmission of pathogens. Method of instruments cleaning: manual and ultrasonic cleaning. In manual, we clean the instruments and cannulas by hands. For ultrasonic cleaning, we place the instruments in the machine for 3 minutes and cannulas 6 minutes. Segregation of instruments. Separate the instruments order-wise, like blunt instruments separately, sharp instruments and sharp cannulas separately, and Simcoe tubing and phaco tips separately. Let me show you a video about instruments cleaning and bin packing.
Materials required for instruments cleaning are ultrasonic cleaner, stainless steel basin, filterized RO water, soft toothbrush, 10 ml 5 ml syringes, hand towel, dryer, tips for sharp instruments and sterile gloves. Before putting instruments in ultrasonic cleaner, it should be segregated as blunt instruments, sharp instruments, cannulated instruments, needles and phaco tips. Instruments cleaning at end of the day, that is by manual and ultrasonic cleaning. Before washing instruments, wash hands thoroughly and wear OT dress with cap and mask and gloves. Instruments washing room should be cleaned and air conditioned. Before putting into ultrasonic cleaner, all instruments should be washed in separate basins. Ultrasonic cleaning. Before putting instruments into ultrasonic cleaner should be cleaned thoroughly, then filled it with correct amount of water because it should not be overfilled or underfilled. To check the working status of ultrasonic cleaner, put a aluminium foil paper inside it and keep it on for 3 minutes. Because due to the ultrasonic vibrations, the aluminium foil paper affected and it gets pores if it is functioning well. So after 3 minutes, check the aluminium foil paper whether pores are present or not. If pores are present means the ultrasonic machines working properly. After checking the function of this machine, drain all water out and again refill it with correct amount of filterized RO water. Then keep the segregated instrument trays inside it. Keep the instruments inside it and switched on for 3 minutes. After finishing 3 minutes, take the instruments tray carefully because sharp instruments will be there. Every cycle we should change the water. Like this we have to wash Simcoe cannula, phaco tips and all instruments. Then comes instruments washing methods. Wash instruments in 3 basins filled with filterized RO water. In first basin, instrument should be cleaned with soft toothbrush and then washed it with other 2 basins. Then keep it in a clean sterile towel. Then dry it with the clean towel and keep the instruments separately. Anyway, these instruments might be wet, so dry it with dryer. After drying, the sharp instruments tips should be covered by IV cannula tips. Then coming washing of phaco tips, sleeves, chamber, irrigation aspiration tips. Wash each cannulated instrument with 50 cc of RO water. That is, by using 10 ml syringe, flush 10 ml of water inside the cannulated instrument for 5 times. Then washing of Simcoe cannula. It has irrigation and aspiration port separately. So each port should be washed separately with 50 cc of RO water. That is, by using 10 ml syringe, 10 cc of water flushed in each side port for 5 times and dry it with compressed air. Next, washing of hydrocannula. Hydrocannula also washed with filtrate RO water by using 5 cc syringe twice a time and dry it with compressed air. Next comes washing of phaco handpiece and irrigation aspiration handpiece. First, the irrigation aspiration handpiece, flush both the irrigation and aspiration ports 10 times with the 20 cc syringe which was filled with the RO water. Then repeat with the syringe filled with air. Washing of phaco handpiece, it has irrigation and aspiration ports. So, irrigation port washed by flushing of filtrate water and aspiration port washed by aspiration of filtrate water. After washing, those cannulated instruments like Simcoe cannula, phaco tips, chambers, sleeves, all should be dried with the dryer. Then, before bin packing, all instruments should be segregated according to the surgery like phaco or SACS, and class 1 indicator should be kept in each trace. Then comes bin packing. Before bin packing, thoroughly clean the bin first, then keep the class 1 indicator over the towel, then keep the trays in a perpendicular alignment, that is in opposite direction. Keep the class 1 indicator in top, middle and bottom of the bin. Don't do tight packing. Loose packing only allows the steam to spread inside the instruments. Keep the class 5 indicator at the middle of the bin. Don't keep sharp instruments at the bottom of the bin. Keep those instruments at the top and cover all the instruments bin with towel and keep the class 1 and class 5 indicator and pack it. The indicators having loading sister name, date of sterilization and expiry date. Instruments cleaning in between surgeries by manual cleaning only. Here the used instruments received from OT. In between surgeries, the knives, visco cannula like disposable instruments should be disposed. Then wash one set of instrument in one basin of RO water. Then instrument tray should be washed in separate bin of water. That cannulated instrument should be washed separately with using syringes. Sharp instruments should be washed carefully. Open the lock and wash the scissors. Take 5 ml of syringe and wash the Simcoe cannula, Vectis and dry it with air. Then keep the washed instruments in separate tray. Then the washed instrument set should be kept in a bin in perpendicular alignment and keep the class 1 indicator in each tray. That indicator should contain autoclave name, sister name, sterile date, expiry date and the load number. Check all and close the bin. Then keep class 1 and class 5 indicator in each bin. Before keeping the bin into the autoclave machine, check the bins whether all holes are opened and open it and keep the bins into the autoclave machine. Then close the door tightly and check the settings and start the machine. Corrosion and rust. Mainly it is caused by tissue debris and salts from the saline irrigating solution which may collect and cause permanent damage. Inadequate cleaning, rinsing and drying also cause damage, and using tap water, a malfunctioning autoclave also cause corrosion and rust. So, cleaning must be done immediately after each surgical procedure. Conclusion: thorough cleaning of instruments, bin packing and sterilization is very important to prevent.
Sterilization, a physical or chemical process that completely destroyed all microorganisms including spores. Disinfection is the process of destroying the bacteria using chemicals. Decontamination is the process of cleaning an objective or substance to remove contaminant such as microorganisms. Disinfectant. Disinfectant or product, a chemical liquid that destroyed microorganisms. Antiseptic is one of the disinfectant used on living tissues and cells to destroy infections. Antimicrobial agent is one of the disinfectant which destroyed the growth of pathogenic microorganisms. Gravity displacement working principles is air with steam. In this autoclave, we are not having pre-vacuum method. We cannot analyze how much it is sterilized the surgical items. In vertical autoclave, if we use signalock or class 1 indicator, will change which reached the sterilization in 100 degrees Celsius. But if we have pre-vacuum horizontal autoclave machine, we can sterile the surgical items 100%, because in pre-vacuum old air removal to be done and fresh steam will be inside of chamber. So we can confirm the 100% sterilization in horizontal autoclave. In vertical autoclave, we not having any printing options. So we cannot monitor the sterilization cycle. As per NABH norms, pre-vacuum autoclave machine are suggested for good quality of sterilization. Parameters: instruments and linen 15 pounds 121 degrees Celsius 30 minutes. Rubber items 15 pound 121 degrees Celsius 10 minutes. Liquids 15 pound 121 degrees Celsius 10 minutes. High speed autoclave in between sterilization temperature 134 degrees Celsius for 7 minutes. Class 1 or 3-line label indicator should be kept in every load and every bin. Do not load liquid and cartons with the instruments bin. In class 1 indicator, mention person name, bin number, load number, date of sterilization and expiry date. Class 1 indicator should be placed in every instruments set. Before close the load, check the bin holes are open or not and the indicators are loaded properly. Monitor the process of autoclave after the things are unloaded in sterile storage area. The door is open. Check the color change of indicators. Close the bin holes immediately before keeping sterile storage area. The sterile storage area should not be damp or wet, with limited access of persons to avoid growth of bacteria or fungi. UV lights or AC to be keeping inside. Minimum of linen bundles only keep in autoclave machine with class 1 and class 5 indicators. Don't mix instruments bin and bundles to avoid overload of steam penetration.
The process of gathering medical devices sterilized in a load that had a failure of one or more sterilizing parameters is known as recall. When change in the indicators is not achieved, the bins in the load are recalled for a repeat autoclave and is known as a recall procedure. Or when the bin bundles are wet, they should be recalled. If devices were distributed to user area, a recall notice is distributed. Several do's and don'ts that are to be followed strictly while performing the procedure of autoclave are listed. The machine is completely automatic and will give an alarm in case of low temperatures, improper door closure, low water and air levels achieved inside the inner chamber, but it will not give an alarm in case of low pressures.
Chemical sterilization, ethylene oxide. We are sterilizing the gas sterilization in our practice, for example, cautery probes, vitrectomy probes, etc., which are not able to do in the steam autoclave. ETO sterilization destroyed the microorganism by protein coagulation and breaking the cell membrane. Disadvantages: 6 to 8 hours for sterilization in long cycle, expensive, potential hazards to patients and staff if exposed. Let me show you a video about ETO things and sterilization.
Ethylene oxide cartridge. Things to be sterilized are cautery wire and tip, vitrectomy probe, light probe, iris hooks, retinal accessories and cotton pads. Class 1 indicator, 3-line label and gun machine. Biological indicator for ETO, sealing machine and medipeel paper, cutting machine or scissors. The above mentioned things are thoroughly cleaned in RO water before sterilization. Retina accessories are cleaned properly to remove any oil, as oil inhibits the penetration of ETO. The sharp tips are covered properly to avoid any breach in sterilization. The things should be properly dried before putting into the sterilization machine. A medipeel paper is used for ETO sterilization and it is sealed using a sealing machine. All the packets are checked properly before sterilization. Class 1's indicator is placed on every packet, which has the operator name, OT name, sterilization date and expiry date. The single packing can be used for 1 month and the double packing accessories can be used up to 6 months. Reusable stickers are pasted over the items like vitrectomy probe, indicating the opening date, number of uses, date of last use and packing person's signature. A ETO sterilization register is maintained containing details of unsterilized items received and sterilized items issued, and signature is taken from the person who packs. ETO sterilizer monitoring printout register is maintained along with biological indicator register, a recall register and ETO validation and service register. The loading and operating of the ETO sterilizer. Before loading, clean the ETO sterilizer with dried cloth. Switch on the ETO sterilizer with main switch and place the cartridge. Automatic cycle is selected. Load the packed material loosely and the packets should not touch the top and the walls of the sterilizer. Class 4 indicator is double packed and placed in the center of the objects to be sterilized. Close the door of the sterilizer. After the temperature has reached 55 degrees Celsius, press Process Start mode. Check whether the process printout is available. After the process is completed, it will show cycle complete on the display, which is approximately 7 hours and 30 minutes. Ensure that the printout is verified by CSSD person. Open the sterilizer door and check the change of color in the indicator sticker. Color must change from blue to green, indicating adequate sterilization. The ETO sterilized items should be transferred to storage room immediately. Check the sterile packages and verify the indicators. Follow first in, first out. That is, the accessories put first are to be used first. Store the sterilized items in the sterile storage room. Unopened packages need to be stored at a room temperature, that is 22 degrees Celsius to 26 degrees Celsius, and at 40 to 60% relative humidity conditions away from direct sunlight. Write the name of the OT where they will be issued and get the signature of CSSD person. If the indicator color change is not adequate, follow the recall procedure.
Importance of indicators in CSSD. To monitor the functioning of sterilizing unit, to ensure 100% sterilization has been achieved completely over all the packages. To differentiate completely the sterilized items from under-sterilized or unsterilized items. Inadequate sterilization will lead on to vision-threatening infection. Role of sterilization is to reduce the overall infection to minimum and improve the visual outcome. Conclusions. Ocular surgeries are very delicate. Any compromise in aseptic technique can lead to permanent vision loss. Thank you to all.